I'll talk to Dave because he's the big ad eater. Oh, she's got that time. Nice. Very nice. Oh, that's good. We had them last Sunday. We put our store-bought eggs, kept them in the refrigerator, and scrubbed the... Oh, that's all right. That's right. I know. That's great. That's good. It's all good. But I mean, I knew that you'd said to wash them. Dave, this is my husband, Dave. I don't know if you come to our church, right? I remember when you were that's right. Isn't that right? We've come. I don't know.
Could I have your attention for a moment? We've been live for about 2 minutes, so you start.
All our private conversations have now been immortalized. Father in heaven, thank you so much for the blessings of this day and the evening that has come. Our bodies are indeed your temples, and there are some issues currently in our culture and in our lifestyle that are serious features or factors in good health. And tonight we are going to discuss one of them. Please be with Gerard and also with Tricia as they share. And we thank you for those who are here in person as well as those who may be joining us online. In Jesus' name, amen.
Amen.
You want us to come down here and sit?
Yeah.
So you can see us?
It'd be fine.
Yeah, we want come down here. It'd be great. If
Last week when we did our seminar, we forgot to introduce ourselves, but then everybody last week was a member of our church and they knew us. So, but Tricia Markoff and me, Gerard, we both graduated from Loma Linda University School of Public Health, Preventive Care / Preventive Medicine, Lifestyle Medicine program. Tricia has been doing school, teaching for pretty much her whole career. I did administrative work, teaching, and clinical work, and always had a passion. We've always had a passion for lifestyle medicine. We've done seminars for diabetics, hypertensives, overweight, and you know what? The information almost doesn't change.
It's so true because I teach out at Western. I told my students, if you just put healthy eating and exercise, you're guaranteed to get the question right when you talk about lifestyle diseases.
So last week we promised we'd let you know the websites, and these are 4 or 5 websites that you might want to consider. Zoe.com, Tricia turned me on to this. They've got a number of podcasts, 20-minute podcasts or 60-minute podcasts. It just depends what you choose to look at. You want to talk about Zoe, or is that enough?
That's enough. It's outstanding now. It's called it brings in leading world experts in all the different areas. So if you're interested in exercise, nutrition, mental health, it's a great podcast.
Nutritionfacts.org is a nutrition that Dr. Greger has pioneered. He found enough money from some donators to give everything free to everybody, mostly. If you want it right now, you have to pay a few dollars. If you wait 30 days, you can get it free. And there are websites, there are presentations, voice presentations, slide presentations. And I've been known to say that if you were to follow that, you would never have to get a master's in public health. Everything's there except the...
Yes.
Oh,
please.
would you please? Thank you. Yeah. Harvard, anything from Harvard is pretty much golden. And the School of Public Health at Harvard has a program called Nutrition Action. And they've got outstanding nutrition information. If you have questions about the Mediterranean diet or the drugs that they're using, I would certainly recommend Harvard. They also have two very powerful studies. The Nurses Health Professional Study, which is using 60 or 70,000 nurses for 30 or 40 years. And they also have...
Physician's Health Study.
well, they have a health professional study, which is mostly doctors, and they have the Nurses Health Study, which is nurses. And any study that follows for 30, 40 years, that information is golden. Adventist Health Study 1 and 2. My wife and I are part of Adventist Health Study 2. Are you part of 2?
No.
And is Warren part of the second one? For years, we would present the information about the Adventist Health Study 1, and now there's much more information. And you can go to their website at Loma Linda University School of Public Health, and you could download slides and articles. I assume they still do that. I don't know why they wouldn't. If you're interested in what the government says about diabetes, you can go to diabetes.org. This is, they have some self-screening that you can fill out. They also have BMI, a body mass index score that you can work out based on your height and weight. And there's a wealth of information there. So in my clinical practice, we followed the CDC guidelines and the Harvard guidelines and the U.S. Preventive Services Task Force guidelines. And because they never came out too late, in my opinion. And they have not yet issued a guideline on COVID vaccination. They will eventually when the information becomes solidified. Okay, so let's talk about diabetes. It's a disease that impairs the body's ability to use food or carbohydrate. Basically, you have an insulin defect, and if you have no insulin, you're type 1 diabetic. If you have insulin that comes out a little sometimes, but not enough, or that's type 2 diabetes. And if you have type 2 diabetes long enough, your pancreas may stop producing insulin. So you want to treat it. Insulin is a hormone that you can't live very long without.
I just want to add,
Yeah.
too, you may be producing enough insulin, but also at the cellular level, you might have an insulin receptor problem, which I'm only bringing that up because exercise is so important when it comes to the receptor on the cells. Oh, sure. Okay. I don't think it's on.
No, it was on before. Testing. Warren, this is the yellow. Put the yellow back on. Yeah, don't confuse me. I plugged it into the yellow plug. It does have a purple, yeah.
How's that?
It
No?
needs to go up to about a 6. Try it.
How's that?
Yeah.
Okay, we're good.
So there, basically, there's about 60% of the population have diabetes, but only 1 in 4 of them don't know it. Prediabetes, this particular study referenced 88 million people have prediabetes, and Tricia found another study that documented 100 million people have diabetes. And
Prediabetes.
Prediabetes, and that means, what does pre-diabetes mean? Well, we used to call it borderline diabetes. And about 20 years ago, we realized that when we tell a patient they're borderline something, they say, oh, good, I'm not diabetic. Or if I'm borderline hypertensive, oh, good, I'm not hypertensive. So they changed the wording to pre-diabetes because it means you are diabetic. You're on the way to being full-blown diabetic unless you make some significant changes. The lifetime risk, 1 out of every 3 persons born since 2000 will develop diabetes.
It was kind of shocking to realize I was halfway to risk just because of my age.
It's incredible. Well, we just listened to a podcast, and there were 3 risk factors to developing diabetes. One was weight. The second one was?
Age. Well, the second one was
lack of
lack
exercise.
of activity or exercise.
And this guy emphasized age. We were shocked. But it's real. It's very true. So if you do get overweight and you don't get enough exercise, you will get older, and so you're likely to develop diabetes.
So if you exercise, is that reversing?
Actually, it does.
Helps significantly.
It can slow down the aging process. So yes, effectively it does.
Essentially, your pancreas just isn't as efficient or effective as it was. As you age, it becomes less efficient or effective.
In this particular study of 50,000 people followed for 18 years, the presence of diabetes more than doubled the risk of mortality. And it was a higher risk than for smoking, for high blood pressure, or high cholesterol. Diabetes is rampant in our American culture. It is doubly rampant in indigenous cultures. When we worked in the islands for 6 years in a clinic there in Guam and other places, the islanders have double the risk of diabetes than we do. Genetically. Well, one reason is their genetics. And number 2 is, after World War II, we, the Americans, supplied them with ships full of Spam and canned goods, and that's what they grew up on.
That is true, but different ethnicities have different
The Native
risks.
American population in America and Canada all are much higher risk of diabetes.
So are you saying that diabetes can be hereditary?
Yeah.
It plays a role, but it doesn't mean that you're doomed if you have those genes. It may mean you have to try a little harder.
There are risk factors that are increased, and if you have those risk factors and the genetic predisposition, you will likely become diabetic. Oh, thank you, Glenn. I already forgot about that.
So if you have a question, there's a microphone available, and that's not so much so that we can hear you, it's so that those watching online can hear you, your question.
So we're not here to disagree with anything your doctors have been telling you. They're measuring your blood sugar, they're having you take insulin or the diabetic tablets, and you need to pay attention to those recommendations, because by law, they need to be telling you to do these things. And if you're not doing the job to lower your blood sugar, they're going to want you to do more of their recommendations. And there's new meds coming out all the time. Ozempic is the latest one that's out there now. I know very little about it, except the Hollywood actors are using it to lose weight. And that is not a good idea. We don't know any long-term studies of what's going to happen to your liver, to your kidneys. And so you need to be careful for using any drugs for cross purposes. The normal blood sugar is what?
70 to 100.
Less than 100, yeah.
Because lower than 70.
Well, you get down into the 50s, you can sometimes start shaking. So we usually don't have to worry about low blood sugar. But you can if you're diabetic and swinging back and forth. An A1C is normal is 5.7, so pre-diabetes is 100 to 125 for glucose, up to 6.49 for A1C, and 6.5 plus A1C for diabetic, and 126 fasting. These are fasting blood sugars.
So everyone may not know what A1C is. Fasting glucose is where you essentially fast. They go in, they check the glucose or sugar level in your blood. A1C, so that's like a snapshot, right? A1C is also a blood test, but it looks at the average blood sugar over a 2 to 3 month time span. So it's much more accurate than a snapshot.
And you don't need to be fasting for hemoglobin A1C blood test. How high sugar? Yes. Use it, Mike.
Back to the A1C. The last time they did my blood work, they came back and they said, your A1C is great. You're exactly where we want you to be. Have a good day.
Well, then you say, show me the numbers.
Well, it would have been less than 6.5, I would expect. Might have been less than 5.7. But they should have been talking to you. Are you on medicine for diabetes?
Oh, yeah.
Yeah. And see, here's the thing. I may get in trouble since I'm recorded. I've worked with medical doctors my whole career. And sometimes we get used to the usual and customary. And they know you're diabetic, your sugar's good, your A1C is good, so you're doing what you're supposed to do. They're not going to talk to you about anything else. They may not know anything about lifestyle medicine. Don't be afraid of that, but you might want to ask them, would it be okay if I lost some weight? Would it be okay if I exercised more? What would happen if I did?
They're so used to seeing the extremes that when they see something that's within an acceptable range, that's it, that's good.
Yeah, a lot of doctors don't even care what your blood sugar is if it's less than 126, less than 126, because you're not in the danger level. You're just borderline, or you're pre-diabetic. And give them a break. They've got a waiting room full of individuals that aren't doing as well as you are. And they want to get back to them as quickly as they can.
Yeah, it's just the good, better, best. You know, so you may be doing good, but that doesn't mean through lifestyle changes you can't do better and best.
So I worked in a number of medical clinics where the doctors I worked with knew this, but they did not have the time to go through the lifestyle medicine principles.
That's right.
I did that for them.
Which is what we're going to do tonight.
Right. Yes, Dale.
I'm on the bad list.
We're working on that.
Is that below good? I'm good, better, best?
Yeah, I'm bad, good, better, and best.
So here's how blood sugar can harm your health. It damages the blood vessels, especially the small ones in the eyes and kidneys. It damages the large vessels as well as the heart, brain, peripheral circulation, nerves, immune system. The whole body's affected. Just think about you throw sugar on the table, and you can scrape it off, no problem. You throw sugar and then some water on the table. Now try and scrape it off. What's it become? It's become sticky. And that's what happens in your blood vessels. Sort of.
But I just want to say, too, that the complications, they are bad complications, but that's uncontrolled diabetes. So it doesn't mean necessarily you can work within diabetes, keep your blood sugar with control, and prolong any adverse effects. So I just want to make that there is some good news.
Yeah, there's lots of good news, except for my dad. My dad was a diabetic, overweight diabetic, and he was happy if his blood sugar was 200.
Yeah.
Because he was on, I forget the med he was on, but if he took too much, it gave him diarrhea. He'd rather have high blood sugar than have diarrhea. And he couldn't work with his doctor. I called his doctor up, and we had a good conversation. He says, yeah, I've asked your dad to do such and such, and He wouldn't. And I said, can I try something? And he said, yeah, go ahead, try whatever you can. It didn't work. So my dad was diabetic. He smoked for years, diabetic. He had peripheral neuropathy. His right leg was purple up to his knee. His left leg was purple up to his ankle. So when I was in Thailand, I asked him if I could fly him over to my clinic in Thailand, and we'd put him through a 3-month program. We only have patients there for 18 days, but he was there for 18 days times 5 or 6. When he left, his legs were nice and pink. The only purple he had left was in his big right toe. He walked every day, 2 or 3 times a day. He worked. He ate what we fed him. He didn't like it.
Amen, brother.
And we wrote a cookbook called Tastefully Vegan that made all the good food taste really, really good. And I forgot to give you one. I'll give you one. But you got to know where to go to the grocery stores to buy the ingredients to make it taste good. Right? Go ahead, say what you're going to say.
I was just going to say, I think through trial and error, you can find foods that you enjoy. And I would just encourage you to keep trying, because eventually you can come to enjoy different foods. You just have to be persistently moving in the right direction. And it doesn't have to be difficult. You don't have to buy unusual ingredients.
Exactly. The grocery stores today all sell good, healthy food.
Yeah.
And that isn't true 30 or 40 years ago, as often as we'd like. Yeah.
If a grocery store has a healthy aisle, what are all the other aisles?
You want to go to the periphery of the grocery store, ignore the healthy aisle. It's probably not healthy. It may be, it may not be. We'll talk about that. All right, we'll move into that.
Well, so my dad was in a wheelchair when he got there, and he was walking to the airport when he left. My brother picked him up in Calgary, and bless his heart, my dad told my brother Jay, quick, take me over to that convenience store. I got to buy me some hot dogs. And I got to buy me a package of cigarettes. And he bought 2 dozen hot dogs, just a hot dog, just the wieners, and a carton, 2 cartons of cigarettes because he wanted them when he went home. And he smoked all the way home and ate half of those hot dogs all the way home because his firstborn, me, starved him. I didn't. He ate all the food he wanted. It just wasn't what the food he ate all the food we gave him, but he didn't eat what he wanted.
I like your dad.
And so I never talked to my dad again about these sorts of things. And when he fell and broke his hip, bless his heart, he was in the hospital at 83 or 4, and he never left the hospital. And my 2 brothers and I, we stayed there at his bedside most of the time. And when he wanted a cigarette, I gave him a cigarette, because it wasn't going to do him a bit of good to stop smoking there in the hospital.
But that's not the moral of the story. The moral of the story is that change makes a huge difference. Your dad was walking, didn't have purple legs. That's the moral of the story.
That really is. Thank you for reminding me of that. But it's just, I love the story, and I love my dad. You know, my dad was fun. He was never upset, never unhappy. And, but he didn't want to change.
Well, I think we need to talk about that. You have to want to have a good quality of life. And if you want to have a good quality of life and not experience complications, that's a choice. And it's not easy, but it's something that you just keep moving towards slowly. Just keep trying. I think I can, I think I can, I think I can.
That's why our lifestyle centers were so popular, because in just a few short days, we could turn around their metabolism.
All right, let's go. We got time. I'm
We gotta
the
go.
clock watcher.
So we know what's going to happen if you're diabetic. Lifestyle choices. Not smoking, of course, maintaining a healthy weight, being physically active, just 30 minutes a day. And then if you miss 1 or 2 days, it's still 5 days a week. Okay? Now, it's okay to do 60 minutes a day. It's okay to do 20 minutes and then 20 minutes and then 20 minutes. It's okay if you do it that way. But if you don't want to, at least get 30 minutes. Yes?
It depends on what's on TV.
Oh,
30 minutes is my minimum,
Good.
that's all right.
That's great.
That's all right.
but sometimes I go 2 hours.
Fabulous.
Nothing wrong with that. And that's why you told me you lost 12 pounds.
That's awesome.
I'm working on it.
So healthy eating habits, high intake of whole grains and cereals with lots of fiber, high intake of fruits and vegetables, low red meat consumption.
Which we'll talk.
We'll talk about all these things in more detail. This is a particular study that they did, the diabetes prevention trial, 3,200 individuals at high risk for diabetes. They were overweight or pre-diabetic, mostly sedentary. They were given a choice. No, they were enrolled in a placebo group, a medication group using metformin, or a lifestyle intervention group. Their weight loss goal was only 7%. That's 10 or 12 pounds, maybe 15. 150 minutes of exercise, and they needed to change their eating habits by eating 25 to 38 grams of fiber, lower saturated fat, and lower glycemic index, lower glycemic load foods. We'll talk more about glycemic food in a moment. In this particular study, those taking metformin lowered their risk of getting diabetes 31%. However, those in the lifestyle change group lowered their risk 58% of getting diabetes. That's why we pound on diabetes, right?
Right, and I think the important fact about that, I mean, that's huge, 58% with lifestyle versus 31% with metformin, which, by the way, is expensive and doesn't come without added additional problems. Anytime you're on a medication, it's a cascade of events. If you can be off, of, which you can with lifestyle changes generally, 58% chance of lowering. Notice the weight loss was only, what, 5 to 7%?
7%, yeah.
7%. That's 10 to 15 pounds. That's so achievable, and it has such a huge impact.
So 10 ways to lower your risk of diabetes. Healthy weight, regular exercise, how much? 30 minutes a day, 150 minutes a week or more. It's
And
okay
the
to
30
do more.
minutes do not have to be consecutive minutes, by the way.
Yeah, you can do 10 minutes 3 times, or you can do 15 minutes 3 times. It's still 30 minutes plus. Limiting your saturated fat, trans fat, high cholesterol foods. I do not recommend going on a low-fat diet. I recommend you eat healthy fats and plant oils, nuts, flaxseed. Choose high-fiber foods, foods low in glycemic index. We'll get there in a minute. Minimize stress. A plant-based diet is most effective for type 2 diabetes. And get adequate vitamin D. Well, why would you need vitamin D? You want to tell them why?
Go right ahead.
We'll get to that. Excess body fat's the greatest cause of type 2 diabetes. So here's a slide looking at as your weight goes up, the green is normal weight, ideal, 25 to 26.9 BMI, your risk is going up. Each of those, and there's a big jump between 13, 17, and 27. So you absolutely need to stay below a 30 BMI, but it's ideal to be in the 25, 26, 27 BMI range. If you don't know what your BMI is, go to that website, diabetes.org, and they've got a calculator. Or just type in diabetes, or type in BMI calculator, and you'll get half a dozen universities will have their BMI calculator there. Now, waist circumference is actually a better way to measure your weight. Waist circumference. Waist circumference. And measure your waist around your umbilical, belly button there. Suck it in if you want, it's okay. Let it out. but kind of keep it tight because you get a better score.
No. Let it out, and then relax.
Yeah.
Don't
No.
suck it in and then measure.
I'm just telling him how to cheat.
I know.
That's all right.
It's like, that's a big difference.
So it's not just your waist size for your pants, because that's usually lower than the belly. Okay, so
It's around your umbilical, like
Yeah.
where you're.
and so men want to aim for waist circumference less than 38, women less than 36.
Yeah, look what happens to the risk of developing diabetes from 31 and then compare that to 41. What a huge difference, even going from 37, just significantly huge. And that's partly because, we talked about this last week, when you measure your waist circumference, that is an indicator of visceral or organ fat. And the podcast that we listened to recently talked about liver fat, and as you have more liver fat, then your glucose levels tend to be higher because the liver allows more glucose to go into your bloodstream. So it's not a good thing to have organ fat around your organs, and so that is why waist circumference is such a...
Yeah, and Tricia mentioned it, but I want to emphasize, this abdominal weight really affects your liver.
Apple at obesity is what.
Santa Claus has diabetes.
Oh, he's been diabetic for centuries. So be physically active. There are many choices. I'm not going to go through that. The benefits of regular exercise. It doesn't take much to improve your hemoglobin A1C. It doesn't take much to lower those, and it doesn't take much to lower your blood pressure and your blood fats. Yes. Microphone.
I just want to make a statement about hearing you talk about exercise and lifestyle. But when you take that little survey, like, are you at risk? Eating healthy and exercising does not change the risk.
You mean the survey on Sabbath?
Yeah,
Survey on Sabbath.
yeah.
Well,
like I said, I'm halfway to risk just because I'm
yeah,
over
but-
65.
But that's not all you have to do. It's not just healthy eating and what was
And
the other one?
exercise.
It's not just healthy eating and exercise. You've got family genetics. You've got, what are the other things on that survey?
Those
Yes, but-
surveys are looking at primarily some non-modifiable risk factors, a few modifiable, but in a short little survey, it's going to be hard to determine healthy eating. I'm surprised it doesn't have exercise.
Well, it did.
Exercise was there.
It was there, but it was like, it didn't make up for all the non-modifiable.
No, it doesn't.
And so it was discouraging to think, yes, I exercise. Yes, I'm trying to eat healthy. Yes, I'm eating these correct foods and stuff like that. Didn't lower it a bit.
Well, just remember that is just a risk assessment tool.
Okay.
So don't allow it to discourage you. It's just for it's a screening tool.
So choosing healthy foods, high in dietary fiber, low in saturated fat, low glycemic index, mostly whole plant-based foods, limiting highly processed foods. Stay away from the ultra-processed foods we talked about last week.
Oh, just out of curiosity, ultra-processed foods, just name a few. I know Spam, okay, but what
Twinkies,
else? Huh? Cheetos? Oh, shoot.
Cheetos, Twinkies,
little
Little
Debbie
Debbie cakes.
Yogurt that is
That's all your
not
favorite food, Clay?
yogurt that isn't plain yogurt. So fruity yogurt that
Or
has.
even vanilla yogurt?
I would have to look, but mostly it's the plain Greek yogurts that are not ultra processed. If you look and see emulsifiers and colors and flavorings and that sort of thing, that's what's defining it as ultra processed.
Dale, microphone.
I have a question there. I love bananas, but every site that I've been on tells me to stay away from bananas because it spikes my sugar.
Good, they're correct.
So,
Stay away from bananas.
I know, but I'm a monkey. I like to eat them.
Here's when we get the glycemic index, I'll use watermelon as a prime example. When I eat watermelon, I'm not diabetic, I'm not pre-diabetic, I'll eat 5 or 6 slices. A diabetic can eat watermelon 1 slice.
Could a diabetic eat half a banana with peanut butter on it if it wasn't overly ripe banana?
It would depend on what else is going along with it.
That's why I was suggesting with the peanut butter and other, yeah.
That's okay. I'm just staying away from them.
Okay,
Yeah.
well, that works for you then. You gotta
So
figure out
far,
what
it is, yeah.
Sometimes you have to realize the benefit, and the benefit is more important than that favorite food you used to have. And you just have to come to that realization.
You know, I'm sorry, I didn't see.
Okay.
I just want to say we keep talking about high dietary fiber. I don't know if everyone is aware, but fiber comes in plant food. So if it is a plant food, it is a source of fiber. And some plant foods are better than others. Obviously, unprocessed plant foods are going to be higher than a processed plant food. So when we're saying fiber, it's just a plant food.
Yeah, what about when you're eating meat and all that stringy stuff you're eating? What is that? Is that not fiber? This is a joke I used to always do. No, that's arteries, veins, and nervous tissue. Okay, enough of that. Most of my seminars were done for non-vegetarians. Oh, Donna, you had a question. Yeah.
You were saying something about the banana. The riper it is, the higher content of sugar. So eat green bananas.
They're crunchy.
Well, when we were overseas, we found there were 5 different kinds of bananas. And one of the bananas, I forget the name of it, had little tiny black seeds in it. You would break your teeth if you ate this banana. So you have to be careful. And we use ripe bananas for zucchini bread and smoothies and other kinds of things. So,
The sugar content changes as it gets riper. That's the
true.
point.
So here are some foods higher in dietary fiber. And Tricia emphasized plants, okay? And fruits and vegetables, legumes, whole grains, nuts and seeds. Fiber slows the absorption of carbohydrates, keeping your blood pressure or your blood glucose lower. Over time, it'll help lower blood cholesterol and help prevent weight gain. Vegetables lower the risk. Aim for 3 to 4 servings of vegetables daily, more if desired. How many of us eat and can't see our plate when we're eating? You know, there's just too much food on that plate, okay? And it's been hard for me to teach my wife, I want to see the plate when I'm eating. She wants to feed me because she wants to make sure I'm happy and content and satisfied. And bless her heart, I love her to death, but I don't want to gain weight. And so when she puts too much food on the plate, I'm usually eating over in my chair and she's not there all the time. What I don't eat, I throw in the garbage. And I've
put it back in the serving?
No. And I've told her that, and she gets mad at me for doing that. And I have a disease that allowed me to see my dad clean up everything that was left over on the plate. The table was finished of all the food when we finished eating. Dad finished it up. He was obese, smoking, and full-blown diabetic. So I can't eat leftovers. I always like to leave something on my plate if I can. I know never mind. Oh yeah, when I was a kid, it was Biafra. You know, we had to clean up our plate because of the starving children in Biafra. I don't know where that is anymore. I think they've changed the name of it. Look at this. It says skip potatoes and French fries. We'll get to that in a minute. Well, we'll get to it now.
Now, this doesn't mean sweet potatoes.
Oh, you're giving away the secrets. White
You are
potatoes.
correct. You are
but You're
correct.
correct. White potatoes are high glycemic index, but sweet potatoes are not.
They're not that far behind though, but we'll show you a chart.
Yeah, we'll show you a chart. So one serving per week of potatoes, your risk was 1, and 7 servings a week, that is potatoes every day, your risk is 33% higher. This was a Harvard study looking at almost 4 million person years of follow-up. So we need to be careful about potatoes, and we'll show you why in a minute. Fresh fruits, lower risk. Again, it's a natural product. Blueberries particularly lower your risk.
No, they lower your risk.
Okay? Blueberries. 2 servings a month, and that's not very much. I'd like to have blueberries every day. I don't, but I wish I could.
Yeah, they're expensive.
Legumes lower, apple and pear intake and risk of diabetes. 1 serving a month versus 5 servings a month. Why? One of the reasons is pectin. There's a lot of fiber in the skin of these fruits. So therein lies a question. What if they're not eating the skin, Tricia?
Well, the thing to consider when you're eating the whole fruit is you're getting all of the whole package. And so you're getting the fiber, but you're also, fruit and vegetables were intricately made. When you start taking things out of them, let's just say we took fiber out and put it in a pill. It's not going to work the same as when you have it in a whole fruit. The same with isolated nutrients. It's a package deal. They work together. There are lots of plant chemicals that work together that are super beneficial. So whole plants.
And here's a high protein food, legumes. Lower blood sugar, blood pressure, and lowers your risk of coronary artery disease. Choosing whole grains. It just irritates me every time the Olympic comes around. We get these gorgeous athletic Olympic athletes, male or female, it doesn't matter, and they advertise Wonder Bread. You know, there's white Wonder Bread. That's the absolute worst bread you can eat.
I just want to say that buying whole grain bread is very tricky. Mm-hmm. So you need to look for the words made with 100% whole grain, not just made with whole grain or whole grain, but it has to have the 100%. Because sometimes there's a little label that actually says what percent by the grain people, whatever their qualifications are. But look for that 100%. Then look at the label, because you may see a lot of sweeteners added to some of these breads. So look for added sugars. You might see molasses. You might see sugar in and of itself. So make sure you check the sugar content of various breads, but look for 100% whole grain.
Try and limit your white bread, white rice. Now that's almost anti-gospel if you try and limit white rice, and it's for some countries of the world. And when we lived in Singapore and Thailand, it was very difficult for us to introduce brown rice. We did, but it was difficult.
Yeah, you may not know this, but when they mill rice and when they mill grain to make it go from whole to processed, that 80% of the nutrients are removed and the fiber is removed. And then they spray back B vitamins and iron to kind of boost it up a little bit. But they've removed the healthy part of the grain, and you're just getting the endosperm, which is the inner starchy part of the grain, and you're losing the healthy fats and the fiber. So whole grains.
Limit sugar and sweets, especially soft drinks. If there is one source of sugar you should absolutely not eat, it is do not drink any sugar. Mm. Now, I like, when I'm traveling, a little bit of iced tea sometimes. And you know how hard it is to find unsweetened iced tea in the South?
It's not hard. I drink it all the time.
It's impossible in a grocery store, in the gas station.
Starbucks.
But we buy
McDonald's.
We buy unsweetened iced tea to drink at home from Ingles.
I'm giving you a hard time.
And we agreed we would do that.
You can find it.
We can do that, but not when you're traveling. It is really hard. Which gas station?
You need to talk to us after the program. We'll help you, Gerard. We'll help you.
Yeah, there may be one unsweetened. All the rest of them are sweetened.
I do want to say
Right, it
soft
wasn't
drinks
peach.
are the #1 source of sugar in
Yes,
the U.S.
yes.
And they have, depending on the soft drink, huge. Did you know, just as a sidebar, that if you divide the grams of sugar by 4, when you're looking at a label, that tells you how many teaspoons are in that particular. And that just helps you, I think, visualize it a little better. So sugar divided by 4, the grams, tells you teaspoons. Just for me, it puts it in terms I can visualize.
So eat primarily whole plant foods. We've talked enough about that. Vegetarian diet lowers the risk of type 2 diabetes compared to non-vegetarians. Red meat intake increases the risk of diabetes.
This is actually, this is worthy of looking at in detail. This was a large study. 216,000 plus people for 20 years were followed. Those eating the most red meat had a 62% increased risk of developing diabetes versus those with the lowest intake. And just by substituting 1 serving of red meat per day with 1 serving of legumes, so you have pinto beans instead of red meat per day, substituting 1 serving of red meat per day with a serving of nuts or legumes reduced the risk by 30%. That's huge.
And these are the numbers there
Yes.
again. And that's not a hardship to reduce your meat consumption by 1 serving.
No, or even by size, because
Because-
for every 3 ounces of red meat eaten per day, the risk of diabetes increased by 12%. So just by decreasing from 6 ounces to 3 ounces, you can reduce your risk. I believe that's how I would read that.
When I ate meat often 3 times a week, or 3 times a day. Then I finally went to oatmeal as a child, as a teenager, and a college student. 3 bologna sandwiches for lunch, and whatever mom fixed for dinner, and it could be a T-bone steak, it could be pot roast, it could be turkey, chicken, whatever. And a serving size of meat is about 3 ounces is about the size of the back of your hand. If you've got a small hand.
Or a deck of cards.
Or a
It's
deck
okay.
of cards. And I don't know of any meat eater, myself included years ago, who would eat just that much.
It just depends on how expensive the restaurant is, Gerard.
It wouldn't matter back then. I
You
mean,
only-
half the plate was a piece of meat. And then I'd eat all the potatoes, and I'd eat half the peas.
But look at the next point. For every 2 ounces of processed meat, so processed meat are your deli meats, your bologna, your hot dogs, the risk of diabetes went up by 32%. That's huge.
That's only 2 ounces.
But the good news is a 1/4 cup of nuts daily, so a handful, had a 21% lower risk of diabetes. Do we have a slide? Are we going to be talking about nuts?
Yeah, we have a
okay,
slide
good.
on that.
Because I am a huge advocate of including nuts in your diet every day.
Yeah, and all the nuts except one. There's one nut you have to stay away from. It's called the donut. And I used to say, I'm sorry, Clay. I used to say you could eat the donut holes until the bakery started selling donut holes. So I had to do that joke now. Choose healthy fats, and there's lots of choices. Nuts, nut butters and seeds, avocado, olives, flaxmeal, olive and plant oils. And there's a Finnish study that looked at the diets or the lifestyle of people that lived to be 100 years of age. And all of these people would eat a liter of olive oil a week. Now that's a lot.
They were, what was their lifestyle? What did they do?
Well, they exercised and had good food, and they ate, 1 serving of meat, and if they drank alcohol, it was a little bit of wine, and, their whole lifestyle was very similar to the lifestyle in the blue zones that National Geographic identified in 5 areas of the world. Loma Linda, our alma mater, was one of them. Okinawa, Sardinia in Italy. And basically, they were all exercising, eating good food, and they had good socialization skills. And their stress was moderate.
I want to encourage, peanut butter is wonderful, but I would encourage you to try the freshly ground peanut butter of just plain peanuts. In the grocery store, Ingles sells it.
Almond butter, too?
It doesn't have sugar in it. It tastes like fresh peanuts. It takes a little bit of an adjustment if you're used to Jif or Skippy, but once you get used to it, you will never go back.
So nuts, those eating the most nuts had a 29% less diabetes than seldom eating nuts. And Tricia mentioned a handful. Again, a study from Harvard, 83,000 women over 16 years. So eat nuts and seeds daily for best health.
It's not just for diabetes health, it's for heart health.
Yes.
We didn't mention the leading cause of death from diabetes is heart disease. So much of what we're talking about is also a heart healthy diet, but nuts have been shown to be very good for heart health. So just a handful of nuts, walnuts, pecans.
You said,
Yes.
I don't see no walnuts up there.
Walnuts, well, they aren't in the picture, but I'm a huge fan of walnuts. Yes.
Yep, all
Is
nuts.
there an issue with cashews?
No.
Right there, son.
They are higher
Yeah,
in
but
saturated
I've heard-
fats, but that's not a major issue. Dale,
I haven't heard you mention anything about salt in any of this. Are you going to get to that?
not really, but
Okay. I'm just.
if you had, it doesn't seem to be an issue for diabetes unless it raises your high blood pressure.
Okay.
But if blood pressure is an issue, then we want to talk about salt.
I'm in good shape.
But if you want to follow the high blood pressure diet, it's basically what we're talking about too.
We go to Sam's and buy the bulk walnuts and pecans. They're unsalted.
So do we.
And keep them in the freezer, grab out what we need to, extend the shelf life.
One thing I have to mention about nuts is I'll often eat a meal without a dessert because I'll go get a handful of nuts and I'll eat the nuts and I'll chew them and chew them and chew them. That paste becomes my dessert. Not everybody likes that, but that's what happens to me. You agree with that?
I think that I wouldn't say that would be my first choice as a dessert.
As a dessert?
But I would say eat some nuts every day.
I didn't mean to challenge you about dessert.
I can't say that a paste from nuts is really going to do it for me, but
But it works for me.
it could work.
Especially if you added in some blueberries.
That's true.
My wife makes some really, really good gluten-free, natural sweet desserts. And I eat them with gusto. So I do eat desserts. So let's talk about glycemic index. Glycemic index is a measure of how fast the carbohydrate in food is absorbed. And high glycemic index food, like white bread, is in that red hump. And it shoots up your blood sugar. Low glycemic index foods, the blood sugar goes up gradually. Now, what happens with the high glycemic index foods, the blood sugar goes up, then it goes down into, what's that word there, down there? It says hunger. Whoa, I'm hungry, I've got to have some more high glycemic index foods. So you have some more and it goes back up, then it goes down.
So your insulin kicks in. It's like, whoa, your blood sugar is high, your insulin kicks in as much as it can, is secreted, boom, it comes down.
And in type 2 diabetics, the pancreas gets tired over time and you become insulin resistant. And maybe your doctors talk to you about metabolic syndrome. It's a combination of high blood pressure and high blood glucose, high glycemic index.
And very small LDL.
And yeah, and high LDL and low HDL. And so you want to reverse that trend. And so you get a lower glycemic index food, and then that glycemic index food in yellow doesn't go into the hunger zone. It's more satisfying. You don't get hungry again in 3 hours.
Not only that, the goal is to have nice little rounded peaks and valleys and not high mountains and lows.
A wave and no tsunamis.
Right, a wave. There you go.
A nice sine wave, no tsunamis.
Yeah. For everything, for thinking clearly, for energy, but especially for...
So here's white bread again on the left, and within 2 hours, that glycemic index is twice what it was there for lentils. And the glycemic index for white bread is 100, and for lentils was only 41. So we want to choose low glycemic index foods. They're basically unrefined, they're whole plants, whole fruits. They're often high in fiber. They help keep blood sugars low. It's low glycemic index foods lower our risk for obesity, high blood sugar and diabetes, heart disease and stroke, and Alzheimer's. So let's look at some indexes of common foods. The goal is to, somewhere around 60 or 65, eat less than 60 or 65 in your glycemic index. So white bread of 71, soft drinks 70, potatoes 82, white rice. You see the numbers there. Cornflakes 93, ice cream 80. Talk about the good ones. Low glycemic index foods.
Right. I'm also a huge fan of legumes, and here you see lentils at the top, but you could put any legume up there.
Yep.
So, and by legume, I mean a bean that you typically think of as a dried bean, so not green beans, but dried bean that you rehydrate. So super, super healthy, high in fiber, high in vitamins, a great meat substitute. So, and then of course, leafy vegetables, and whole fruits. And interestingly enough, when we get to the grains, you'll see oats, you'll see old-fashioned oats, you'll see steel-cut oats, and you'll see instant oats. And the more processed those oats become, the higher the glycemic index. So the least processed, the better. So I love steel-cut oats. That's my go-to breakfast when I have time to cook them.
And there's a nut on there that you're emphasizing.
You ever tried them? No? They're oatmeal, but they're a way that they're less processed than instant or old-fashioned.
It takes longer to cook
It does take longer to cook. They're tasty.
And look at
I
those-
put my chia seeds on them and some chia seeds and walnuts and blueberries. It's like a feast.
You can add flaxseed to it.
Yeah.
Many different things. Look at the
So-
almonds. Index of 15. Glycemic index of fruits. Watermelon, 72.
Yeah.
That's over the 60 benchmark. But again, have one piece if you're diabetic. If you're not, have 4 or 5.
There's banana at
Look
62.
at bananas. It's 62. It's just over that 60 mark. Blueberries, 53. Peach, 42. Apple, 40. Strawberries, 40. And cherries, 22. And so the orange, 40. Grapefruit, 25. Those are the...
Is that per serving?
No, this is an index that was given to...
Because is that like one cherry?
No. This is an index of, I think it's 100 grams of this product, and they analyze it, and they burn it, and they figure out how much energy is being released, and it's an index. So typically you can eat more cherries than you would eat watermelon. That's what
And the juice would be higher, though, wouldn't it?
Yes.
the cherry juice. Oh yeah, the
Or
juice
like
would be higher.
orange juice or anything like that.
All juices. We'll get to that. I think we have a slide on that.
Okay, here's the baked potato, 111. The white boiled potato, 82. Sweet potato, 70. It's still over 60, but it's, you don't eat sweet potatoes that much, but a little bit is okay. Sweet corn, go ahead.
No, I was just going to say the sweet potato has so many more, it's packed with so many nutrients, but you don't want a giant sweet potato with brown sugar and butter added to it, half of a giant sweet, with other foods.
Why would you eat it without brown sugar and butter?
Clay, we need to have a conversation.
I can see. I think Gerard is available after this
Cinnamon is
program.
okay. Cinnamon's okay.
Oh, sure, cinnamon's okay.
I will say the sweet potato helps the kale go down easy.
And look at that spinach and kale and broccoli, in the tens. I don't care how much of that stuff you eat.
Yeah.
I don't eat that much. I married a Southern girl. I can't stand boiled spinach, but I'll have 1 teaspoon just to say I eat spinach. But I love okra, made any which way. Boiled okra, fried okra. What's the other way to do okra? That's kind of a Southern thing. And so, onions, asparagus, mushrooms. Oh boy, my wife loves mushrooms. I can't stand mushrooms. So I get other sources of protein. Mushrooms are... Redskins would have more fiber in them because you're eating the skin. Yes?
What about a microwave baked potato?
Well, it's still a baked potato. And if you're diabetic, you might only want to eat half of that.
I was going to say, you realize you're not eating these foods in isolation. So it's how much of it you're eating and balancing it with other foods. That's right. And not eating it alone. Like, okay, for lunch I'm having a baked potato. That would not be advised. But if you have a small potato with your protein and your vegetables and some healthy fats, that's a different scenario.
Well, they're not that big anyhow.
Clay, you had a question.
Yeah, does pickling vegetables change the sugar?
Pickling?
Yeah.
So you're adding...
like okra.
Yeah, you're adding vinegar, spices, and I have no problem with that unless your stomach is irritated because of it.
Unless they're, what are those sugary pickles that you make? What are those
Bread
called?
and butter pickles?
Yeah, bread and butter pickles. That's a different story then.
No,
So
for-
what are you doing to pickle and then that answers the question.
Now, fermented foods, didn't you just listen to a pod on fermented foods?
It's supposed to be very good for your gut.
Yeah, that's a deadline. We might do a study, we might do a conversation on
Yeah.
gut biome.
Gut
but
health.
Maybe, we're not sure yet. But fermented vegetables, as long as you're not
Kimchi,
negatively affected by the
sauerkraut.
vinegar and the high concentration of that, it's okay. Various grains, look at the French bread, corn flakes, 93, 95, rice,
White rice,
white rice, 89, and brown rice over on the right there, 50.
Look, so here's the instant oatmeal, 83. Here's the old-fashioned oat, 55, and here's the steel-cut oats, 42. So I'm not saying everybody should eat steel cuts, but it's a lesson in the more processed it is, most likely the higher the glycemic index when it comes to grains.
Glycemic index of beverages and other foods. I'm sorry, I'm reading the next slide. Legumes and nuts.
Here we are, we already talked about this, but...
Yeah.
Well, look at the baked beans are higher, though, because of the sugar in them, and mostly, I'm sure it's because of that. I would guess.
Beverages and other foods. Gatorade, 78. Soft drink, 70. Cranberry juice, 68. It's interesting that orange juice is only 50,
Oh.
but it's
You
got
realize, though, a serving of juice is 6 ounces.
yeah, but it's got the fiber in
is-
it. If it's not,
The pulp is rude.
if there's pulp there,
It's
yeah.
still not optimal. Juice is not optimal.
And I agree with that. We need to eat the whole fruit rather than just the juice. Sugar, glycemic index of 100. Rice milk, 85. Ice cream, 80. Table sugar, 70. Honey, 61. See, it's getting healthier, but it's not there yet. Milk from cows, say 41, soy milk 30.
That probably is unsweetened soy milk, because you can get it unsweetened
Yes.
as well as sweetened.
So in general, we want to eat less of the high glycemic foods on the left side there. Any question about that? And eat more of the low glycemic foods on the right side. Oh, let me mention, you can go to those websites, we told you about it early, and you can get whole lists of glycemic indexes of foods. And if you go to the American Dietetic Association website, and you search there, you can get glycemic index of foods. Or you can just go to Google and type in glycemic index, and boom, that they're all there. And if they come from a university you've heard of, then that's a good idea. Vitamin D protects against diabetes. Persons in the lowest third of vitamin D and those in the upper third had a 40% lower risk of developing type 2 diabetes. I knew about diabetes for years, and we preached it in our seminars for years. I thought, well, maybe I should get my vitamin D checked. It was 22. It should be over 50. I was shocked, because I was outside, I was running, I was swimming, I was riding my bicycle, and I just had an absorption problem because of my celiac disease. I didn't know I had celiac disease. I had it for 20 years before we finally diagnosed it in my son before we diagnosed it in me.
And even if you feel, it's worth getting checked, your vitamin D, first of all. Okay, great, then. But even if you think, oh, I'm out in the sun, for 6 months of the year, we are below the latitude where you're going to absorb enough vitamin D from the sun. So yeah.
Most people, especially south of the Los Angeles parallel and down,
We're right on the...
I think we're right on the borderline. Most people need a vitamin D supplement, but work with your doctor.
Sorry, we're above the latitude. I
Get
said below.
get a test and take a supplement if needed. So for diabetes prevention, what do we want to do? Be more active. Adjust your diet accordingly. Lose just 10 pounds if your risks are high. Don't smoke. Choose healthy foods. Emphasize unrefined, high fiber, plant foods, whole foods. Limit refined carbohydrates. It's okay to have birthday cake every once in a while, but you don't need to have it every day. Sorry, Clay. Limit red and processed meats. Use vegetable oils in place of solid fats. Choose primarily lower glycemic index foods. I didn't say eat no high glycemic index, but you can eat those once a year. High glycemic foods you can have once a year. All the other stuff you need to have every day.
That list missed the main point.
And what is that?
You just don't need to grow old.
That's true. Age is a risk factor for developing diabetes. Yes, no question. Dale.
Okay, you got up there, don't smoke. Is it okay to chew and dip? I just thought I'd
I better look over here to make sure. Well, here's my answer, and I'm sure Tricia will agree with this. There's over 3,000 chemicals when you smoke one cigarette. If you chew and dip, there's less chemicals, but there's still a tremendous amount of harmful chemicals and huge carcinogenic ones. You're just...
Do you want us to take our pictures out of oral cancer from chewing and dipping? You don't. Switching out lung cancer
Does,
for tongue cancer.
and your dental hygienist looks at your oral cancer risk every time you go in there.
Yeah.
So if diabetics follow the ABCs of diabetes control, A1C below 7, blood pressure below 130 over 80, which is still pre-hypertensive, cholesterol, LDL cholesterol lower than 100, and it should be in the 60s. Dietary goals to eat more primarily whole plant-based foods high in fiber and low glycemic index foods, exercising daily. Your goal is at least 30 minutes every day, and if you miss 2, you're still getting the goal 5 days a week. Okay, that basically concludes our seminar. Tricia, do you want to add anything else?
Now, I just want to say that sounds overwhelming when you look at that like a list. But I just want to encourage you to pick one thing and start moving towards it. And just keep moving towards those goals. Set smaller goals. Say, okay, maybe I don't exercise 30 minutes, but I'm gonna go walk for 15 minutes after dinner, right? And then then add up. I'm gonna walk 15 minutes after lunch and 15 minutes after dinner, or I'm gonna walk 30 minutes after dinner. And the same with your meal. Pick one thing that you think maybe is making the most negative impact, and swap it out for something else. You don't like it? Try something else until you like it. Find something you like, because I just want to encourage you to move towards healthy goals, because you will feel so much better. And you do not want the complications that come with sustained, uncontrolled diabetes.
Once you start, and like Tricia said, you feel better, that feel better should overwhelm the feeling bad from before.
Yeah.
And that's key. Any questions? Would you like to close?
One quick question about exercise. You keep talking about walking, just walking. Any other exercise would benefit, like we could do 50 minutes of powerlifting instead of 30 minutes of walking?
Weight resistance exercises are also incredibly important. So this is what I would say about choosing an exercise. The number one thing is find one you like, that you are going to enjoy doing. You don't like it, you're not going to do it. Whether it's group exercise, individual exercise, whatever. But I would really recommend the lifting and some aerobic activity. Optimally, you would do like a walking 3 days a week and lift 2 days a week. But that's optimal. Again, good, better, best. So find something you like.
And when you
Well, I enjoy the walking, but I always end up at the refrigerator with the ice cream.
Well, I know you do some carpentry, Clay, so when you walk to get that 2x4, just walk a little faster.
Oh.
And you're lifting. See, he's getting it both at the same time.
And Dave and I try to, sometimes we exercise together. That's a nice time that we can spend together. So sometimes we exercise together, sometimes with friends, sometimes individually. So,
Yes.
I don't set no records when I exercise,
You
but
don't-
I do. I go every day.
that's fantastic.
You don't have to set records.
I mean, and
That's
people
fantastic.
look at me like I'm a calf looking at a new gate, but
If-
that was my goal, is to continue.
If you're walking on your treadmill 2 miles an hour, that's fine. If you're walking 3 miles an hour, that's a little bit better. If you're walking 5 miles an hour, that's probably too much.
But it depends on what's on TV.
There you go. And if-
So watch a high action show.
I do, Andy Griffith. Or Law and Order.
There you go. One is a little slower pace, one's a faster pace.
Since we're here in church, let's close with prayer.
All right.
Would you?
Dear Father in heaven, we are wonderfully made. You have just made us in your own image, and it's a gift. And we thank you for that gift. We thank you for the information we have tonight. And I just pray for every individual here that whatever changes they may need to make, that you give them the power and the motivation and the courage to make those changes. We thank you for loving us and for caring about every aspect of us. In your precious and holy name, amen.
Amen.